Hello, and welcome to our practice. We hope to make this a place where you can leave your worries at the door and obtain relief from the symptoms that bother you most. Ketamine therapy has a multitude of benefits and is now being used for a variety of medical conditions, including depression, anxiety, PTSD, and chronic pain. Recent data indicates that ketamine infusion therapy is the most effective and fastest-acting antidepressant discovered to date. Research is showing positive response rates as high as 75 to 80%. Many patients obtain relief of their symptoms after just 1 to 2 infusions. Others may not notice a substantial improvement until further into the infusion process. On your first visit, you will meet with your healthcare provider. They will review your medical history, perform a physical exam, and determine if ketamine is a recommended and safe treatment for you. If your provider feels that ketamine therapy may be beneficial for you, he or she will discuss your treatment plan along with the associated benefits and side effects. After your initial consultation, a member of the healthcare team will escort you to the infusion area and assist you with making yourself comfortable. One of our team members will insert an IV catheter into your vein and prepare to start your infusion. If you are prone to nausea, please be sure to notify your provider. This fairly common side effect can typically be prevented with appropriate medication administered prior to your treatment. To ensure the safest infusion experience, we will monitor you and your vital signs throughout the infusion. For most, the infusion process is a very enjoyable and tranquil experience. Some patients may experience mild anxiety. Note that this is a normal response, and our staff will be nearby to reassure you. If you have any discomfort or anxiety during the infusion, please let us know, as we may make adjustments to your treatment, which will improve your infusion experience. To have the most enjoyable experience and to get the most out of your infusion, it is important that you begin with a relaxed and calm mindset. Activities that put you most at ease are recommended. These things might include listening to peaceful music, resting your eyes, meditating, or watching relaxing nature scenery on an electronic device. Upon the completion of your infusion, you will be asked to remain in the clinic for a brief period of recovering and monitoring. A member of our healthcare team will prepare you for discharge. He or she will assess how you are feeling, and if you are ready, he or she will remove your IV. Please be aware that it is hazardous to drive a vehicle or operate machinery for a period of 24 hours after your infusion. We also advise that you don't make important decisions during this time period, as your judgment may be impaired. After the initial series of infusions, we encourage patients to return in 2 to 3 weeks for their first booster. We have found that patients that wait too long often decline too far and require more than one booster in quick succession. After the first booster, most patients fall into a 4 to 8 week booster cycle. The timing of boosters is highly individualized. Regardless of the timing, a single infusion will bring about the same reduction in symptoms as the initial series, and typically, the beneficial effects last about the same amount of time as the initial series of infusions. Your ketamine provider will discuss this in more detail with you. If you haven't already pre-scheduled your infusion, please ask about scheduling your next appointment prior to leaving, as some days fill up fast. Thank you for choosing our clinic. It's an honor to provide your care, and we look forward to helping you in your journey to recovery.